So with that, I'm going to kick off today's session, and it is my very great pleasure to start today with another patient perspective and their journey through cholangiocarcinoma. And I'd like you to give a very warm welcome to Tamara Mulley, who's going to join us on the stage.
Sorry about that. Good morning, everyone. Such a pleasure to be here. I'm Tamara Mulley. I'm 28 years old, and I have stage 4, which is what I like to call currently incurable cholangiocarcinoma. I have metastases in my liver, lymph nodes, hip, spine, collarbone, and my lungs. So when I first saw my scan, I'd say it kind of lit up like a Christmas tree. But my story starts all the way back in February 2023, when I first went to my GP feeling just not quite myself. I didn't have any specific symptoms, kind of per se. I was just a little bit low energy, a little bit couldn't be bothered, which is very strange for me, as I'm normally a real kind of go-getter, but was kind of very quickly dismissed with some blood tests. You're 26 at the time, so it's probably not going to be anything too serious, and we'll refer you to a gynecologist, because if it's anything, it's probably something like endometriosis. And being a relatively kind of fit, healthy 26-year-old, I kind of took the doctor's opinion and ran with it and said, yeah, you're right, there's probably nothing really seriously wrong. Up on the slide are some pictures of things which I managed to do whilst I now know, in hindsight, I had stage 4 cholangiocarcinoma. And this is just to show that not everyone presents with kind of jaundice and the symptoms that are kind of really commonly spoken about, and lots of people are kind of able to get on with their, normal, or in some cases up there, relatively abnormal lives in the meantime. So, as you might be able to see out there, I was still kind of working full-time in a job that I really love. I was living with my boyfriend. We were traveling the world. We went to kind of New Zealand, as well as kind of many countries here in the UK, and doing, really active things, going to the gym 3 or 4 times a week, and kind of everything was fine-ish, apart from this kind of weird feeling that I just wasn't quite myself. And it wasn't until December 2023 where I essentially thought I really had a bad cold. And thanks to my doctor's surgery having no appointments till the following February, was sent to A&E, which at the time I thought was a complete overreaction. I often say that within my bubble of unluckiness, I'm incredibly, incredibly lucky. And the first example of this is the fact that I did even go to A&E, and it's only because I had no plans that night that I did. Had I had dinner with a friend, I promise you I would have gone to dinner with a friend instead of going to A&E for what I thought was going to be some antibiotics for a cold, and then sent home. And I was so lucky that in going to A&E, the very first thing that they did when I presented with the kind of cold symptoms that I had was to do an X-ray. And it was on that X-ray that they first saw, a suspicious shadow. And I'm sure for kind of lots of patients in the room, you're all familiar with what happens next. It's just kind of endless phone calls, back and forth, lots of scans, until the Friday before Christmas 2023, where I was taken in to a room, actually with a kind of lung cancer specialist, and told that I had stage 4 cancer of some sort. but we don't yet know the origin of that. All of that happened before the gynecologist appointment, which I was originally kind of referred from my GP for. And again, I don't resent anything, and I don't look back kind of with any kind of anger or resentment or anything like that. However, I do think it's an important thing to highlight to show that actually the stresses on the NHS at the moment are very real, and that does have an impact on people, because it may well have been, if I'd been able to get that gynecologist appointment earlier, you know, those kind of ultrasounds, etc., could have picked something up, which, you know, could have led to an earlier diagnosis, which, if you are going to have cholangiocarcinoma, is what we would all want to get. So, I was relatively lucky that the diagnosis of cholangiocarcinoma was done in a number of weeks. And when I got that diagnosis, the first thing I was told is that the disease is incurable, which for, again, a relatively healthy at this point 27-year-old is always going to be a massive shock. But before my consultant could even start to talk about years, months, how long you might have left, I kind of said, I'm not interested in the prognosis. In that kind of split second, I'd already decided that for me, what I wanted was treatment which was going to allow me to live as well as possible for as long as possible. And that kind of quality of life side of it is something which is incredibly important to me. I'm not interested in extending my life by 3 years if it's 3 years being spent in bed not being able to do anything. As you can see, I'm a very active person and kind of want to continue to be able to do as much of that as I can. Treatment started very quickly. I was very lucky with the kind of standard cisplatin, gemcitabine, and durvalumab immunotherapy. And I also had radiotherapy to the cancer which was in my lungs. When I first saw my treatment plan, I saw the word written next to it as palliative, which as a patient, especially of 27, is not something that you want to see, and I found that relatively difficult to see and kind of deal with. After 3 months, despite a few complications, my first scan showed that treatment was going well, and the same happened after 6 months, which was 8 cycles of that kind of chemotherapy and immunotherapy. The guideline suggests that 8 cycles is the kind of recommended amount of chemotherapy that you should have. And originally I thought that that was all that it was possible to have. It was only because my healthcare team looked holistically at the situation, saw, you know, this is really working for Tamara, and it doesn't feel like the right thing to do to take her off a treatment that is working, that they made, in many ways, the incredibly brave decision to keep me on that treatment. So I think I'm incredibly lucky that my healthcare team listened to me when I was talking about how I was feeling, how I was dealing with all the side effects and how I was tolerating the treatment, but also what I wanted out of my treatment, which was, you know, to live as long as I can, as well as I can. And I'm so incredibly lucky that they looked so holistically at that situation to make that, you know, incredibly brave decision. I won't bore everyone with the detail. I'm sure patients here are very familiar with it. But essentially, we kept on having scans every 3 months, and it kept on essentially being the same until a month ago or so, when my kind of general checkup scan started to show some disease progression. But that was after 20 rounds and 15 months of chemotherapy and immunotherapy. And here is just a handful of things which I managed to do in that time, both good and bad. So I'm not trying to say that chemo is an easy ride. It's definitely not. As you can see there are some pictures of me in hospital and kind of chilling out a lot at home, which there was definitely a lot of, but there was also a huge kind of number of memories made with my family, with my boyfriend and with my friends, and doing things like, being able to meet my goddaughter, which for someone who is unlikely now to be able to have children themselves is really so, so important, and, a real blessing to me. When it comes to treatment, I'm not suggesting that what was right for me and those 20 rounds of chemo is right for everyone. And that is not my call to action today, is not to load everyone up with loads and loads of treatment. But it does highlight the importance of treating every patient as an individual, and most important, listening to them and making shared decisions. When it comes to my diagnosis, I knew that something was wrong. I knew that there was something not quite right with my body, and what my GP lacked at that time was the professional curiosity, I guess, to take things further, and the assumption that because of kind of my age or my lifestyle, I was probably fine. I also think that knowledge is really important. Everyone in this room would have learned over the last few days, if you didn't know it already, that cancer generally, but especially cholangiocarcinoma, is increasing in young people. And therefore, I think the knowledge of that for healthcare professionals is incredibly important, so that when they do see people presenting, especially with these really non-specific symptoms, they're able to kind of double check in their head if they think things might need further investigation. Listening to patients and being inquiring early on could mean earlier diagnosis and a more kind of successful outcome for patients. So that's what I'd really encourage everyone in this room who is lucky enough and has the privilege to be in that position to do. I'm also really excited to hear about some of the early detection methods, which importantly are also really cost effective, which are so desperately needed in this space and for this disease. When it comes to treatment itself, again, listening to the patient is so important, especially if a patient has an incurable diagnosis. You need to understand what it is that they want from their treatment. For me, if there's something which might kill cancer, give it to me. I want it. And that is kind of all in the efforts for me to live as long as possible, as well as possible. But there are people for which treatment might have more of an impact on, or they just have different priorities, and they might say, I'd prefer not to have any treatment at all because I want to go traveling for 6 months and just really be able to enjoy myself as I always have, without the kind of pressure of going to hospital every week. And we all know some of the complications that can come with that. So listening to patients in terms of what they want out of their treatment, but also how they're feeling. Then it means that when you're making treatment plans, those are decisions which can be kind of shared in terms of those decisions which are made. And also you can make decisions which are based on kind of the holistic view of the patient, how they are, how they're feeling, how they say they're feeling, and what they want, instead of just blindly following clinical guidelines, which I know it's very easy to do. What that's meant to me is the ability to do all of these things in time which I didn't necessarily think I would have when I started my treatment. Especially as more young people get this disease, I think taking this approach is even more important because, they might challenge you in terms of what they're able to tolerate and what they want to do with their lives in the potentially limited time that they have left. But in saying that, what I want to end by saying is that in terms of that kind of luck that I feel that I feel so incredibly lucky to have been here for the conference the last few days, hearing about amazing advances in treatment, which has really reframed me thinking of my kind of palliative care and I think we should all start talking a little bit more about life-extending treatment. I've always said I only need to stay alive long enough for the next drug to come out, and if I can do that for long enough, then who knows what may come down the line. And I hope that I'm lucky enough to be back here, perhaps even talking to you guys again for many, many years to come. So thank you very much for your time, and enjoy the rest of the day.